Welcome to the Relationships Inside Out podcast with Doctors Gregory Siebert and Kimberly Murray, licensed marriage and family therapists. Join them on this journey as they explore the ins and outs of relationships.
Well, welcome to Relationships Inside Out, where today we're going to be talking about trauma.
Trauma is a unique experience. It's one that can start in vitro. So when we're still in mom, all the way throughout the course of the lifespan.
Yeah. And trauma is an emotional response to a very, very serious event, right? Whether a car accident or a life-altering event, or, those are some of the big traumas, right? You could even experience it from a loss of relationship or loss of a loved one for whatever reason, right? So there's a lot of events that could happen that might elicit that emotional response for somebody.
Whether you're directly as in part of that event or you witness it, or even what we call vicarious trauma. So hearing about the trauma.
Yeah, there's a lot of different ways. And I cringe when I hear other people like, well, why do you have it? I've been through worse. Like, why are you experiencing trauma? And it's like, they're still trying to figure out like what's predictive. Like, why are some people more susceptible, right? Of course, if you had trauma in your childhood, you're more likely to develop PTSD later in life, right? So they definitely know things like that, but there's just too many variabilities on an individual level of why somebody's experiencing this versus another person, right? I look at like veterans or people at war. Some people might see the worst stuff and not really experience any trauma related symptoms, but then you have somebody who doesn't see anything, but they're over there and there's kind of this sense of loss of control and that elicits it.
Any multitude of things, right? And it's relative. So the way we experience it is relative to our other lived experiences for many people, much like pain, right? My pain threshold is quite a bit higher than my hubby's because I've given birth to a baby. And so now I know what max pain threshold for me feels like. So the little pains aren't quite as bad. For my hubby, he hasn't experienced that level of pain. And so smaller pains might impact his body differently. It doesn't mean one of us is stronger or weaker. It means that our nervous system's responding differently to different levels of pain. Trauma's the same, right? From what we know, is that for some people, they can process it in a different way. They can hold that space in a different way than others. Again, not about strength or weakness here, but capacity perhaps, or previously lived experiences.
And it just is, right? It is. Doesn't matter like
it's
why.
Not a judgment thing.
Yeah. I mean, if you're experiencing these symptoms, then this is what we need to focus on, that emotional response. And the biggest thing, especially when we look at criteria for diagnosing, like the DSM-5, the Diagnostic Statistical Manual that we use to guide diagnosis, it really needs to impair your ability to function. So a lot of us might be experiencing these symptoms for whatever reason, right? But it has to impair your function in some way. And like, for example, this might look like one of the symptoms, diagnostic criteria is irritability or aggression.
And this is with post-traumatic stress disorder, PTSD.
Yeah. And one of the criteria is irritability or like aggression, right? And of course, this has to occur greater than a month. But that impacts relationships all the time. Like, that's impairing your ability to function. Like, you can't hold relationships because it's coming out, right? Easily triggered, things like that. And one thing that I hear a lot with clients is, I feel hijacked. I don't feel like myself.
Yeah.
And it's because a lot of things, what's happening is your right brain, right, where the emotions and the movement, like all that is kind of like trapped in there. And so you're just responding to that, right? So your kind of other brain, your logic brain is like, why am I responding this way? But you feel like there's no control.
I often hear people too say things like, well, just stop thinking about it. This is not a choice in, choice out thing, people. If you've experienced trauma, your brain is going to keep score whether you like it or not.
You know what I love about that? Stop thinking about it. One of the criteria is avoidance of thinking or feeling related to it. And there's a lot of things. And
cringe.
One of the things, like a message that I really want to get across for those who've experienced it or are experiencing it, is a lot of the symptoms you're experiencing do not make you crazy. They're normal. And I'm talking even not even be able to hold a conversation because you lose track of what's happening, or you put the milk in the cabinet and the cereal in the fridge, or you don't know where you put your keys down, or maybe your phone. Like, your brain after a traumatic event is not encoding new information. It's still scanning for threat. It's not encoding where you put your keys. It doesn't worry about that right now. It's worried about
the bigger thing.
The bigger things, threat.
Right. Your brain is made for survival. If we're still in fight or flight or freeze, our brain is going to live there for quite a bit of time. What we know is it taxes the adrenal system. And the adrenal system, if it gets really worked, can take not just like hours, but weeks, months, even years to recover, depending on the event.
Yeah. So give yourself some compassion, or have compassion for those experiencing it. A lot of these symptoms are normal. And the good thing is there's a lot of treatment for it. So
other symptoms that we might see are things like flashbacks. So feeling like I'm directly back in that event, not just a memory, although memory is part of it.
Yeah.
But actually feeling like I'm back in there. Think 5 senses. I tell people that trauma lives in all 5 senses. It's not just thinking about it. It's now I can feel it again. I can smell the place again. I can feel what my body felt like. I can hear the sounds, right? It is truly all 5 senses engaged. And a flashback puts you back there with all 5 senses engaged.
Yeah. You feel like you're reliving it. It's not the unwanted, upsetting memory, which is also a criteria. Of just like, I remember it and it's upsetting. It causes emotional and physical reactivity. The flashbacks is truly thinking you're there. I always think of like the veteran flipping over a table. They think they're getting attacked. Like in that moment, they're there. They're not like in the doctor's office, wherever that might be happening.
It can be nightmares. So reliving it in your sleep. This is really disruptive for people who experience this. It makes it so we aren't sleeping well. We might even fear sleeping. So we try to avoid sleep, try to keep our body awake. And it perpetuates the cycle of irritability.
Yeah. And then avoidance is a big one. So even just avoiding thinking or feeling feelings related to the incident, or avoiding any like physical reminder, anything that might
trigger it.
Trigger it, right? So this kind of deliberate avoidance.
Even a sound or a smell, right? Like I've worked with sexual assault victims before. So the smell of a certain cologne or a certain touch of fabric or color.
Yeah.
Right. Anything that pulls you back. And we don't, correct me if I'm wrong, but we're not entirely sure why certain details stand out to people, but they do. For some, it might be smell. For others, it might be texture or color or context.
Yeah. Yeah. I look at what was encoded in that moment of that, very, very awful incident.
Other symptoms might be things like depression or anxiety.
Yeah.
Right. I am mourning a loss of something. I don't feel like I can go outside. I don't feel like I can function. I might not trust people the same. So I don't have a relationship now. Yeah.
That persistent negative affect. And it could be fear, right? That kind of guides your behavior or anything like that. It could be like difficulty experiencing happiness, feeling isolated. It could be the fact that now, even more so than normal, you have exaggerated kind of negative beliefs around the world or yourself. And I say more so than now, because I think there's some normalcy to this based on what everything's happened with COVID and things like that. So always look when I'm assessing, I'm like, well, what more than what's kind of you've had more than recently, right?
In isolation in terms of you'll never understand.
Yeah.
No one will ever understand that event. Or, well, I'm the only one that experienced it. So even when I'm talking to my partner about it, can they understand? No. But can they join you in that space? Yes. Right.
Yeah. Difficulty relating, right? Difficulty connecting and relating to others. I mean, that's a hard one, right? When we think about, because you feel isolated, you feel like no one will understand. And granted, your perspective has changed through a lot of this stuff, right? What was important to you before is not important. Yeah. I think about those who, are less materialistic now. They don't care about the small little things or name brands or anything, because they experience a life-altering event and they realize that the value of what they're valuing now has changed. So it's hard to relate to people, and you might not connect to the people that were in your life prior.
I witness a lot of birth trauma through the clients I work with, as well as experience my own. And a big piece of this is also this loss of what I thought it would be, right? Loss of expectation, loss of that hope or that joy, and reconciling that.
Yeah.
And people, in all well-intentioned, right? And this happens in all kinds of trauma. Let's say with birth trauma, people say, well, at least your baby's healthy.
Oof.
Well, at least you had a baby. Well, at least you were able to give birth, or, oh, you can forget about that now because you have your baby. And these comments do not do what people expect them to do. They actually create a lot of invalidation and kind of worsen that traumatic response.
Yeah. And unfortunately, it's because these people are uncomfortable with having to listen and hear what this person's going through, don't know how to respond. So the best thing they know to do is fix it, right? Because it puts them in a situation where they either try to fix it or control or criticize. I mean, there's different ways that we respond to the uncomfortableness of other people's pain, emotional, physical.
That shows up with all kinds of trauma, right? If it's, say, sexual assault, we turn it to, okay, well, now we're going to get justice. And that's good. But again, it doesn't leave room to talk about the real pain that's still sitting there.
Yeah.
Imagine it's true for veterans, right?
Mhm.
I have no idea what that experience was like. So for someone who doesn't know, sometimes it can be hard to join in that space or to know what to say or whatever it might be. So we try to say the best we can, and it can actually create more pain.
Depending what's happening, right? Especially if you're not like anyone trained in this and you're asking them about the stories and it's kind of bringing it up for them and triggering it in a very uncontrolled space.
Yeah. Mm-hmm.
Seeing somebody trained in this is very, very important.
Very different.
Because there are ways to help someone process through this, so it's not as impactful in their ability to function, right? So going back to symptoms, because I do want to talk about the function piece, like we're talking hypervigilance, heightened startle response, things that kind of interrupt your day-to-day. Like you can't focus at work because you're hypervigilant. You can't sit in a classroom because people are behind you, or you can't even go to work because you don't want to drive because you were in an accident. Things like that. I mean, these are life-altering in many ways that unfortunately are impacting you even further, right? It still has control over the individual.
We hear people say, in like a cheeky way, it absolutely grinds my gears of, oh, it's such PTSD after dinner last night with my in-laws or whatever. And it just cheapens this so much. True PTSD, one, needs to be diagnosed properly by a trained professional, but two, is not this like toss it around term. I mean, this is a profound experience in diagnosis. And
importantly is, even if you don't meet criteria for diagnosis, those trauma-related symptoms are still impactful and important and still can impact your life, right? Because I get clients who meet all the criteria except for avoidance. They don't avoid it. They don't avoid anything. They're, so that's fine. You don't make criteria, whatever that means for you, but they're still experiencing symptoms. So we're still going to treat those symptoms. So it doesn't lessen the experience just because there's a diagnosis or not either, right? Which some people, for some reason, think.
I think it's often out of our own discomfort, right? This idea of comparing, this idea of minimizing, moving on. It's out of our own discomfort to hold space for that.
Yeah.
Or to give truth to other people's stories, right? Because if I'm sitting here saying like, that's no big deal, you won't believe what I've been through. It is very much a big deal to the other person. Just because you don't interpret it as a big deal for your body does not mean that didn't have a profound impact for the other person's body.
Yeah, exactly. Yeah. And people experience the different symptoms at varying degrees.
Yeah.
Too, right? Not everyone's going to have the same symptoms. It's not going to impact them the same. But neither here nor there in the regards of their experiencing trauma-related symptoms. And the best we can do is support them, follow their lead, whatever they're comfortable with. Don't push.
But in any case, oftentimes this won't just go away on its own, right? We have to seek some treatment from, again, trained professionals. I cannot emphasize this enough. This is one area where, okay, a little bit of a soapbox. Therapists that think that they treat everything, don't go to those therapists for trauma work because it needs to be someone who's actually trained in the space. It is a delicate space to be in.
Yeah, they have to know and have a knowledge and a background to understand what's happening, especially like in the brain, right? Because just think about it as like a tree, right? Talk therapy's in the branches around this stuff. I love this analogy. I got this from one of my trainings.
I'm digging it so far.
So in the branches is really a conceptual piece of what happened, and we talk about it, right? But then there's the part of us that respond behaviorally and emotionally that we feel like we have no control over. That's in the roots. A lot of talk therapy can only get to the branches. And there's certain therapies like EMDR, brain spotting, somatic therapy that really get at the roots. Because what's happening is a lot of the trauma gets frozen in time in the right side of the brain, right? The emotions, kind of the behavioral response. The left brain is the logic piece. There's really a disconnect there. That logic hasn't made meaning of that, right? Like they're not connected yet. And a lot of talk therapy don't do a good job at kind of connecting those, right? EMDR, brain spotting, all that, and somatic therapy are designed to kind of connect that body and mind piece of this, which is very difficult and can be very difficult to go through, but they're very, very, very effective treatments for trauma. And granted, for some people, talk therapy might be effective. But I always think about, if you can recall the event, does it cause a reactivity in you, in your body, in your emotions, in your mind? If it causes a reactivity, there's still a charge, right? So it hasn't been fully processed.
So EMDR, let's talk about that one.
Yeah, I said a lot of acronyms, right? So EMDR is eye movement desensitization reprocessing. The idea here is to use what they call bilateral stimulation, right? It's from the theory that like when you're sleeping, your eyes move back and forth and your brain's processing information. So they're doing the same thing in this regard of, we're going to have them reprocess this using this bilateral stimulation to help make a connection between the right and left brain, right? That's a very, in its simplistic form.
And it is profoundly helpful. For some people, I've heard some misconceptions around like, oh, it'll just numb me out. It'll not be helpful. What do you say to those things?
I mean, to some degree, I mean, I look at it as like, it's decreasing your activity. It's putting you back in your window of tolerance to manage the memory of that. Right. And kind of like pain, like once you're through it, you don't look back and like, I'm not in pain anymore. You just kind of go on with your life, right? Like you have to reflect back to know that it's work. And a lot of times, same with the trauma work. Sure. You're like, oh yeah, I guess I'm not really impacted by that as much. And I'm sleeping. Oh yeah, I guess I am. So it takes time reflecting and really getting to know your goals from the get-go of like, what's happening? What do we want to help improve? Like what's a symptom of you re-experiencing this trauma, and then kind of reflect back. Because sometimes, yeah, it's not this like stark contrast, like I'm amazingly cured and through this. And for some, they can get through using EMDR, brain spotting, somatic therapy very quickly, and some might take longer. It depends, right? What type of trauma they went through. But numbing, I'm not sure I would probably use that language. I would probably say more of, you have less of a charge. You're more
processing through it.
Yeah.
Rather than, when I think of numbing, I think of like pushing away, whereas this is more processing through it.
Yeah. And that's the thing is, and that's what I think some people are afraid of, is having to reprocess it, but you're doing it very controlled in a safe space. And it's very controlled. It's very structured approaches.
All three of those require pretty intensive training, for one. And for two, they may not work for everyone, and that's okay. So in the case that they don't, we know that there are other treatments too, right?
Yeah.
One big one is CBT, cognitive behavioral therapy. Let's talk about that one a little bit. That
trauma informed. Yeah.
Yeah. It underlines pretty much all therapy that we do to some degree. The shift is that trauma informed piece, right? Let's talk about that a little bit. How do you use that in your practice?
So the big piece is obviously around kind of understanding the meaning and narrative they have around why the event occurred, right? That's the big one for me. Because that in itself, and the meaning of the self-blame, right? It was my fault, and trying to work through that kind of narrative. That
cognitive piece, the thoughts.
The negative cognitions about oneself. Yeah.
Then behaviors. How do we act this out? How do we behaviorally change our space based on trauma? How do we process through this using behavior? Things like this.
Yeah. And there's different approaches for different people. And I would say it's important that during this work that we're not using anything that numbs our autonomic nervous system. Like we're 100%. Very present with it, right? So benzos, even if you're having like a prescription, right? So benzodiazepines, anything that suppresses that nervous system response, like you kind of want to be there. You want to be able to process it and not numb through it.
For some, see, this is where it gets tricky, right? Some of the research would say that having like SSRIs, so antidepressants, anti-anxiety medications, can provide us a catalyst for change, right? So they kind of numb a little bit, but it gives us the tolerance, the threshold to be able to handle it. But the hope is that eventually we're moving off of them, that we're not staying on them forever, right? So they might give us that initial catalyst or boost to get through the starting work, but the hope is to move off of them and through them. Yeah.
And more important. Yeah. And I think along with what you're saying is that it's really helping them be able to tolerate the ab reactions that one might experience when trying to recall or go through and reprocess. Because that's really important, as you're able to tolerate these ab reactions. And also importantly is when you're going through any of these things, like EMDR or things like that, with having to process, there's no like right way for you as the client to kind of process or what you're thinking of, right? I mean, just being there and kind of pulling these memories and doing the work. I mean, you're doing a good job.
I often encourage people to pair it with some sort of like movement, or so dance therapy would be one, or yoga is a big one. Even things like, say it was sexual assault, taking a self-defense course, things where we also get to feel our body when it feels safe, right? And to get in touch with our body. This is not the start of your work with trauma. Sometimes it can feel too overwhelming to get in touch with our body. But as part of the longer trajectory, I encourage that of people too. Kind of connect both.
Yeah. And what would you say, and how would you say people can support those going through this? Because we talked about it a little bit earlier on in this episode of how people respond and just kind of follow the lead. But what are some actually tips do you think of that we use for those like loved ones who are around somebody like that? Because it's sometimes very difficult. It changes dynamics. It disrupts family dynamics very much so.
I encourage patience, right? Patience doesn't mean that I accept everything. So if my partner is really aggressive, I can have patience, I can love them through it, and I can encourage them to get treatment, right? It can be a both and. I also encourage that if they want to talk about it, give space for them to talk about it without solution. So the goal here is not to fix it for them. The goal is to validate, to join in. Wow, that sounds incredibly tough. What was it like for you? What is that like for you now, talking about it?
Yeah.
But on the flip side, also not pushing someone to talk about it. If they don't want to, don't push them.
Have conversations of what your partner might need if they are experiencing kind of an abreaction or reactivity to the memory of this. If you talk about it, right? What do they need in this moment? Of course, if it gets violent in their violence, the first and foremost thing is safety. Safety for yourself and that person or your partner or family member, whoever it is. Safety is big, big, big. So that's the first and foremost. So what does safety look like? Like if this were to happen, I need to X, I need to call this person, or I need to do this. Having a plan in place is going to be very, very important.
I hesitate saying it, and I think it's important. Obliging the avoiding temporarily, right? So if my partner says like, I can't handle this certain scent, or I can't go in big crowds. Okay, I can support and love you through that. But I'm also going to support and love you into treatment, right? The goal isn't to enable avoidance for the rest of forever.
Yeah.
But we can still give a compassionate space to, okay, right now that's too much, and I can respect that.
Yeah, I love that, because what you're doing is you're helping, at least in the temporary, remove triggers that might cause flooding. So that person can even be a place of functioning to make a decision to like go to treatment. Or
because once we flood, right, this is when our prefrontal cortex shuts down. We're back in the brainstem. Once we flood, there is no rationalizing. There's no reasoning. It isn't a intentional or conscious process. And so once someone floods, bringing them back can be really challenging. And pushing them past that point, it's not like, well, if you could just get through this, if you could just face the crowd, you'd be okay. That's not how this works.
Yeah. Yeah. And even for loved ones to understand that the process is not linear.
Yes.
Right. There might be days and weeks that are better and some that are not, or months that are worse than others. But over long term, if they're getting consistent treatment and good treatment, and the treatment's effective for them, you'll start seeing improvements.
Even anniversary dates of when the event happened, if it's a singular event, right? We can think like, oh, I'm doing really good. And then that day or that month hits.
Yeah.
And shit gets turned upside down. This is common.
And you know what's surprising is a lot of people who come in who want to work with trauma, you start assessing and you realize that they're coming in without them even knowing. Unconsciously, they're coming on the anniversary date. They don't know, right?
They don't even know what's happening, but their body's cueing them in.
Body, emotion. It's very interesting.
That's why even things like with death. So if your loved one goes into hospice, most states offer free therapy for 13 months. And I've had people be like, oh, that's kind of a weird number. It's intentional because it's past the point of the 1 year anniversary, not 12 months. We don't want to cut you off from treatment at that critical point. We want to get you past that first anniversary, that first set of holidays that precedes the death or whatever it might be.
And if you need longer, that's okay too.
Yep.
Right. This is kind of how I look at it. There's no time on the recovery of this, as long as we're engaged in recovery.
And you can think you're doing great, right? Like, let's go back to birth trauma. I often have this with moms. Okay, I'm ready for my birth. I've got this. Shit, I'm in birth with my second one. And all of that's flooding back to me.
Yeah.
And it can feel overwhelming, right? So what tools can we build in for when we do get triggered? What tools can we build in for the supporting partner, persons that might be there? Things like this. If it's a certain scent, say it's the smell of the hospital, having essential oils with you to interrupt that scent. But different kinds of coping tools. And as a loved one, helping facilitate that dialogue. And even if you need to, write it down, keep a list. Things that you can do to help them cope through it.
Yeah. And coping through, again, is one. And I want to go back to the importance of getting into treatment that is actually focused on the root to move it from the right brain into the left and make that connection. Because a lot of times then you spend your rest of your life just doing these coping skills. And you want to get to a point where it doesn't have much charge. And it's not impacting you to where maybe you do go through birth and, that's kind of, the charge isn't there for you anymore.
And I want to say this. So EMDR, brain spotting, somatic, yes, super helpful. And for some people, it's not a good fit. You can still get to the root in talk therapy if someone is skilled in this area.
Yeah.
So if it feels like, gosh, I can't find one of those, so I'm just doomed, you're not doomed, right? But it's still finding someone who's trained in that space that can help left and right communicate to help process through it.
Yeah. And we forgot to mention narrative therapy, which I love.
Yep.
Going back and kind of looking at the story that was authored. I look at childhood trauma, and the story that young child made of why that happened, right? Often self-blame, and we're told that it was your fault and you're the reason. So taking that kind of adult self and going back and reauthoring that story.
With kids, you bring that up. Play therapy is huge. Kids don't, especially like that 6 and under, don't tend to operate in the same way adults do. Surprise, surprise. And so sitting and having talk therapy likely won't work for their body.
Yeah.
So we see kids reenact trauma through play. And that is both in the play therapy space as well as at home. That can be a cue that our kiddo's struggling with some trauma if they're engaging in violent play or whatever it might be. But play therapy is incredible resource for kids where we can use things like art and sand tray and puppets, all kinds of things to process through the event and then help left and right speak with one another to actually heal from it, not just quote unquote, forget about it or numb it out.
Yeah. And it's important for the parent looking at this, like there's stuff happening. There's intention behind this, right?
There's such a bad connotation with play therapy that someone's just watching your kid for you for half an hour, an hour. True play therapy, again, is a specialized training.
Yeah.
You become a registered play therapist, and that's what you want for your little kids. Let me just say this. You want your kids to have a registered play therapist, whether it's trauma or not. But it is a very specialized training of using play intentionally, much like we would talk therapy, to process through anxiety, trauma, whatever it might be. It's not just random play.
Yeah, the person trained know what's happening.
Yes.
There's a function for it. And as you said, it's trying to get that right brain.
It's just the way they communicate.
Yeah.
Right. When we talk about love languages, little kids don't have the same love language as we do. Play is their love language. Connection is their love language. And it's also the way they communicate, the way that they tell you they're not okay or are okay. Same is true in trauma work with kids.
Yeah. Yeah. Just think about the play therapy parents are like, what's happening? And that's even true in like EMDR and things are like, well, what's happening, right? Some concepts like, what is this voodoo, right? And it's part of the process. There's research on it, right? There's a reason why this is done the way it's done. Unfortunately, part of it is trusting the process and trusting that who's trained in this is going to know what to do and how to, carry you through this safely.
Trauma is a tricky one, team. It is different for everybody. It is stored in all 5 senses. The brain is a highly complex part of the body. And we're only scratching the surface on knowing how trauma works within the brain and body. But what we know is that it takes some intentional work to move through it. It's not something you can white knuckle through or will just go away or any of that business.
Or drink through or use drugs through. Not ideal.
You have to face it.
Yeah. And you're not alone. And I want to go back and reiterate, just because you're experiencing these symptoms, you're not crazy.
You're not crazy. Your body's doing what it is meant to do.
Yep.
As weird as that sounds, it is trying to
protect you,
prevent the threat from happening again, keep you aware, keep you vigilant. It's exhausting though, right? So how do we move from my brain is doing what it's supposed to do to, okay, brain, now I'm ready for you to calm down just a wee bit, right?
Yeah. And I love this analogy when talking about trauma, like in the cave analogy, which I think we talked about before, but when someone experiences trauma, we go back in this cave, our brain goes back in this cave. Everything's dangerous. And we stay there. And depending on if you get help or not, you may or may not venture back out of that cave. And the goal for treatment is to kind of get you in a very safe way out of this cave to re-experience life. Very slow, right? So you're not flooded, and use the tools and the skills to get to that point so you don't have to isolate. You don't have to be alone in this fear, right? With this hypervigilance and symptoms. So,
well, this has been Relationships Inside Out, where today we talked about trauma and PTSD. As always, if anyone has any questions, please feel free to email us at relationshipsinsideout@gmail.com. Otherwise, we look forward to chatting with you next time.
Thanks.